Schwannomas are benign nerve sheath tumor arising from differentiated Schwann cells. They are encapsulated and well circumscribed. Most cases have a zonal pattern composed of cellular antennae A areas with nuclear palisading, the Verroque bodies, and a hypocellular component known as antennae B areas. All ages can be affected. More common it is in between 30 to 60 years of age. Male and female ratio is equal. 90% are sporadic and 3% with neurofibromatosis type 2, 2% with schwannomatosis, 5% with meningiomatosis with or without neurofibromatosis type 2. Most affected sites are the limbs, with a predilection to the upper limbs, followed by head and neck area, including the oral cavity, orbit, and salivary glands. Deeply seated tumors are mainly in the posterior mediastinum and retroperitoneum. Other areas are posterior spinal roots, bone, gastrointestinal tract, pancreas, liver, thyroid, adrenal gland, and lymph nodes. Grossly, schwannomas are usually solitary. Mostly lesions are completely encapsulated. Nerve of origin may be present at the periphery but does not penetrate the substance of tumor. Large tumors have an eccentric position in relationship to the nerve. Cut section is light tan as shown in the image and glistening and may show some yellow patches. Large, long standing tumors may be cystic and areas of hemorrhage may be seen. Microscopically, these are biphasic tumor comprised of hypercellular antennae A areas and myxoid hypocellular antennae B areas. Nuclear palisading around fibrillary process, also known as Verroque bodies, is often seen in cellular areas. Cells are narrow, elongated, and wavy with tapered ends interspersed with collagen fibers. Tumor cells have ill defined cytoplasm and dense chromatin. They may exhibit degenerative nuclear atypia, cystic degeneration, and hemorrhage as seen in the ancient schwannoma, which I will be talking next. Blood vessels may be thickened, hyalinized, and may contain thrombi. And sometimes glandular spaces are there, which are lined by Schwann cells, representing the degenerative Verroque bodies. In this micrograph, you can appreciate the highly cellular antennae A areas and the myxoid hypocellular antennae B areas. Also, if you notice carefully, you can see the palisading of the Verroque bodies. Variants of schwannoma. There are main three variants of schwannoma: ancient schwannoma, cellular schwannoma, and epithelioid schwannoma. In ancient schwannoma, features include hyalinization, nuclear atypia, and hemosiderin deposition. It should not have conspicuous mitotic activity or other features suggestive of malignancy. Cellular schwannomas is completely composed of antennae A tissue areas and devoid of Verroque bodies, most commonly seen in the paravertebral region. Epithelioid schwannomas are single or small groups of epithelioid Schwann cells with moderate amphiphilic cytoplasm and occasional nuclear pseudoinclusions. At last, coming to the treatment part of schwannoma, surgical excision is the treatment of choice and local recurrence is uncommon.